Okay, so I will say that we can go ahead and get started. So thank you so much for joining, Norma, and thank you everyone who is already in the chat and in our participant list. We're so excited to have you back for this wonderful afternoon session. So let's go ahead and get started. So it is National Consumer Protection Week, everybody. And so we are hosting this wonderful series of webinars all throughout the week. We start on Monday and we're going to go all the way until Friday, having a morning and afternoon session from wonderful consumer protective services all across Texas. So we will be having 2 more sessions tomorrow, one in the morning from the Veterans Association, Office of Inspector General, and then also from KeyPro. And then right now the session will be with APS McAllen with Miss Norma Rodriguez. So we are the Texas Senior Medicare Patrol, and we're so excited to be hosting this for everyone. So what is the Senior Medicare Patrol? So we are a federally funded program. There's one of us in every single state, and so we are specific to Texas. What we do is we recruit and we train volunteers and professionals about Medicare fraud and abuse, and we also are a reporting agency. So we report intentional fraud and abuse to Medicare fraud control units, such as Medicare, the FBI, the Office of Inspector General, and so on. Our mission here at the Texas Senior Medicare Patrol is to empower and assist Medicare beneficiaries, families, and caregivers to prevent, detect, and report healthcare fraud, error, and abuse through outreach, counseling, and education. So that is a very beautiful way to say that we fight Medicare fraud. We also are a volunteer-run organization. So if you are interested in the work that Senior Medicare Patrol does, please consider joining our volunteers. You can go ahead and just scan that QR code or follow our website there at the bottom. So please, if you are interested in anything like this, consider joining our volunteers. Also, this is our hotline number. It is completely toll-free and confidential to call and report Medicare fraud. So that's going to be 888-341-6187. All right. And without further ado, I would like to introduce Ms. Norma Rodriguez from the Adult Protective Services of McAllen. Thank you so much for being here, Norma.
Thank you for inviting me.
Yes, I'll go ahead and stop my share and you can take over whenever you're ready.
I am ready right here.
Also, for everyone joining, I will be moderating. So go ahead and just send any questions or comments you have in the chat or in the Q&A section, and I will be able to facilitate that for Norma at the end.
Okay, with that, I will start with Adult Protective Services overview. About Adult Protective Services. Our mission statement is to protect people aged 65 and older and adults 18 to 64 with disabilities from abuse, neglect, and financial exploitation by investigating and providing or arranging for services necessary to alleviate, prevent further maltreatment. Okay, a mission statement. Our mission statement is to protect people aged 65 and older and adults 18 to 64 with disabilities from abuse, neglect, and financial exploitation by investigating and providing or arranging for services necessary to alleviate or prevent further maltreatment. Facts and figures. In 2020, Texas APS program received 117,034 intake reports. Of those cases, APS confirmed 73,567 perpetrators. In Region 11, APS received 10,955 intake reports. Of those cases, APS confirmed 6,293 perpetrators. More than 3.5 million older residents in Texas. Almost 1/2 of all elderly nationwide have a disability. 1.7 million adults with a disability in Texas. Nearly 1 out of 7 people have a disability. Facts and figures. Statutory authority, federal and state. Title 20, Social Security Act, Human Resources Code, Chapters 40 and 48, Texas Family Code, Title 4, Health and Safety Code, Chapter 532 and Chapters 591 to 595. These are the statutory authority that we have to abide by about the people we serve. Who is eligible? APS serves people over the age of 65, 18 years and older with a mental, physical, or developmental disability that substantially impairs the person's ability to provide adequately for the person's care or protection. What is a substantial impairment? A substantial impairment is a disability that grossly and chronically diminishes physical or mental ability to live independently or provide self-care. A mental, physical, or developmental disability, a medical condition professionally diagnosed, reported, or observed behavior that is consistent with such a diagnosis, causing a long-lasting and considerable inability to live independently or provide self-care. Verifying impairment, activity limitations, shopping, cooking, housekeeping, administering medications, dressing and clothing appropriate for the weather, obtaining needed medical services, support services, or transportation, making sound decisions or preventing harm to self or others. Abuse, neglect, and exploitation. Definition of abuse: negligent or willful infliction of injury, unreasonable confinement, intimidation, or cruel punishment resulting in physical or emotional harm or pain to an elderly or disabled person by the person's caretaker, family member, or other individual who has an ongoing relationship with the person. Abuse indicators: bruises, burns, unexplained injuries, pushed or shoved, manipulated by force, bathed, changed, or dressed with unnecessary force, forced to place limbs in unnatural or painful positions. Verbal, emotional abuse indicators: fear of the perpetrator, low self-esteem, depression, caretaker yelling, cursing, or screaming, threats of harm, intimidation factor. Definition of sexual abuse: non-consensual sexual activity, which may include but is not limited to any activity that would be a sexually oriented offense per Texas Penal Code, such as indecent exposure or public indecency committed by a paid or non-paid caretaker, a family member, or another individual who has an ongoing relationship with the alleged victim. Sexual abuse indicators: sexually transmitted disease, unexplained pregnancy, unexplained rectal bleeding, bruising, or other injuries. Definition of neglect: the failure to provide for oneself the goods or services, including medical services, which are necessary to avoid physical or emotional harm or pain, or the failure of a caretaker to provide such goods or services. Neglect indicators: malnutrition, dehydration, poor hygiene, evidence of inadequate care, unsafe, unsanitary living conditions, lack of basic necessities or needed equipment, over or under medicating. Behavioral indicators: fear, anxiety, nervousness, refusal or reluctance to talk in presence of a caretaker, disorientation or confusion, agitation, contradictory statements, afraid to get family in trouble, no one else available for caregiving. Definition of exploitation: the illegal or improper act or process of a caretaker, family member, or other individual who has an ongoing relationship with the elderly or disabled person, using the resources of an elderly or disabled person for monetary or personal benefit, profit, or gain without the informed consent of the elderly or disabled person. Impact of financial exploitation: loss of resources, loss of independence, increase in mental health issues, inability to pay expenses, inability to replace lost assets through employment, inability to hire an attorney to pursue legal protections and remedies. Indicators of financial exploitation. Sudden changes in bank account or banking practice, unexplained withdrawal of a lot of money by person accompanying the alleged victim, unapproved withdrawal of funds using an ATM card, unexplained missing funds or valuables, providing substandard care, unpaid bills despite having enough money, sudden appearance of previously uninvolved relatives claiming the rights to a person's affairs or possessions, providing unnecessary services. Perpetrator indicators prevents the client from speaking or seeing visitors, friends, or family. Anger or indifference, aggressive behavior towards the client, history of substance abuse, mental illness, criminal behavior, or family violence, lack of affection towards the client. Conflicting accounts of incidents, talks about the client as being a burden, shows more concern for the inheritance than the client, blames the client for their actions, flirtation or coyness as possible indicator of inappropriate sexual relationship. Investigations and reporting. Who we investigate? We investigate self, caretakers, family members, ongoing relationship with alleged victim. In-home investigations are responsible for investigating abuse, neglect, and exploitation for those who reside in the community. These include private homes, adult foster homes, unlicensed board and care homes, 3 or fewer individuals living in a home. Investigation and assessment. Is immediate intervention necessary? Initial client face-to-face visit, conduct safety assessment, initiate collateral contacts, document and collect any evidence, emergency services needed. How to file a report. Texas is a mandatory reporting state. Abuse hotline, our number is 1-800-252-5400. If an emergency, always call 911. Who is required to report? The law mandates any person 18 years or older who suspects that a vulnerable adult is in a state of abuse, neglect, or exploitation shall immediately report the information to Adult Protective Services. Helpful information for reporting. Name, date of birth, and current address of the alleged victim. A brief description of the situation. Details about the alleged perpetrator. Current injuries and medical conditions. Names and phone numbers of relatives, neighbors, and friends that may have knowledge of the situation. Reporters should provide all appropriate contact information. Reporter information, all information pertaining to the reporter shall be kept confidential. Identification is prohibited by policy and statute. Exceptions, some legal situations. Investigative process. Our investigative process is the cases go to our statewide intake office, and then a priority is assigned. Then a case initiation is done within 24 hours. We interview alleged victim, collaterals, and alleged perpetrator, gather all evidence, and determine a conclusion. Client rights. APS may furnish protective services to a person who is age 65 or older or is an adult with a disability. With the person's consent or without the person's consent if the person lacks the capacity to consent and meets conditions in Human Resources Code 48.208. A person lacks the capacity to consent to receive protective services if because of a mental or physical impairment, the person is incapable of understanding the nature of the services offered and agreeing to receive or rejecting protective services. Clients may refuse to cooperate with investigation, refuse or allow staff entry into their home, refuse protective services with capacity to consent, participate in service planning, select least restrictive alternatives, refuse medical treatment based on religious beliefs, regardless of capacity. Court-appointed attorney ad litem. Some legal alternatives that Adult Protective Services uses is an emergency order for protective services, court-authorized entry, prohibit interference with the investigation of protective services, unrestricted access to records, petition guardianship to Health and Human Services Commission. Service delivery is focused on an individual plan developed to reduce or eliminate further risk of harm. The caseworker, along with the client, defines the problem and decides on the course of action. Potential courses of action: helping the client find money management resources, setting up provider services, Meals on Wheels, emergency response system, referring to other agencies for continued assistance, assisting with home improvements in order to continue living at home safely, providing a safe environment, purchasing life-sustaining medications, immediately intervening for the client's safety, make a referral to guardianship, collaborative efforts. Emergency services would be food, medications, and other supplies, emergency shelter and alternate living arrangements, heavy house cleaning, and minor home repairs, utility initiated, reinstated, and recovered, medical and psychiatric assessments, facilitating services provided by other agencies, involving law enforcement. Send a copy of every report received. If abuse, neglect, and exploitation constitutes a crime, investigative and technical assistance, personal safety concerns, notification at the conclusion with results. APS does not conduct criminal investigations. Be a champion for older Texans and those with disabilities. Report abuse, neglect, and exploitation. And that is the presentation.
Okay, wonderful. Thank you so much for all that information, Norma.
I will email you the document right now.
Okay, wonderful. Thank you. And we will have this uploaded onto our website. So we'll have the
Okay.
recording with all the information and then also have the slides available there for everyone who is watching.
Okay.
So
Do I
now,
send it to you, Ms. Sansi?
yeah, go ahead and email it to me. And in the meantime, please, everyone, feel free to put your questions in the chat or in the Q&A section. The Q&A section does allow for anonymous asking. So if you are a little shy, that's totally fine. You can just throw it in there. I do see your question, and I'll just wait for that email to come through before we ask.
I'm trying to. Okay. You should be getting it.
Okay, wonderful. Thank you so much, Miss Norma.
Not a
And
problem.
I do see our first question. So we have a Miss Rose asking, how often can Adult Protective Services provide assistance to the same consumer?
It depends on the case by case that we receive on that same consumer. Sometimes we have to really look into what type of services they're requesting. They might ask for help with electricity one time, and then if we get them back, they might be facing eviction. Then that would be a separate scenario. So they would probably get the help with both services.
All right, wonderful. Thank you. And thank you, Rose, for your question. Yes, you are welcome, Rose. All right, anyone else? I know that was a lot of information.
Yes, and I'm sorry that I couldn't get it to be shared there. But
No, that's totally okay.
You've got the PowerPoint now.
Yeah, so we'll all have access to it super soon. Okay,
Yeah.
I see another question in the chat. The question is, how many seniors do you serve in a year, approximately?
Well, like I said, in Region 11, we had over 10,000 reports. So you get to see all those 10,000 within the year. And every year they continue to increase. This past year, we might have gotten up to 15,000. And we have
Wow.
all of them have to be visited. You know, they all have to be seen to confirm if they're going through abuse or exploitation. They have to be investigated regardless.
Wow. Thank you. And so there is a question related to that as well. It's at what point does APS decide to make a face-to-face visit with a possible abuse or neglect victim? So is it as soon as it is reported?
All cases have to be seen face to face. They do get given a priority. If it's a case that's a priority one, those cases need to be seen within 24 hours. If it's a priority 2, you have 3 days. If it's a priority 3, you have 7 days. If it's an exploitation case, you have up to 14 days, but it depends on, let's say, because they're being exploited, they have no utilities, they have no food. Those we have to go within 24 hours to visit.
That is awesome that y'all are able to get into action so quickly.
Yes.
Do you mind asking, how many team members do you have, to be dealing with 15,000 seniors? That's quite the workload.
In the area I'm talking about, there's about, I want to say about 40 workers, frontline workers, and it's still not enough because some of these cases they go through the legal system and all that. So it takes a lot of time, and the cases don't stop coming in. So the workers are always on the go.
Yeah, absolutely. That is quite the caseload to take on.
Yes. Yes.
And then I have a question is, do y'all work with any certain organizations or partner with anyone in the area to help ease that workload or to help get resources to these adults?
We work with other state agencies to get some of the resources. As far as the investigation, it's our department that has to conduct those. But we do get law enforcement if there's severe cases to where there is actual physical abuse and all that. We have to have law enforcement because they're the ones that do the criminal part of the investigation in conjunction with what we have to do. We have to find the resources to keep the client safe and protect them from continuing to being exploited or physically abused. We try to use the least restrictive, but sometimes the least restrictive is not appropriate for that one client who has nobody to care for them. Then it's a different situation. But it's worked on a case-by-case basis. So.
Yeah, of course. Well, I would just like to say on behalf of everyone, thank you so much for the work that APS does. I mean, it sounds so crazy that that workload.
Yes.
We do have one more question. It says, does APS conduct capacity assessments?
We have contracts with the psychiatrists that do that for us. We do it through Zoom. If the client refuses to leave the home, they prefer to have it done at home. So we use our tablets to do those. And we have the doctors speak and ask the questions directly to the patient or the client. A lot of our doctors are from Houston or that specialize on that. So they do a lot of that. But we do provide those assessments. And if they're local and they're willing to go get assessed in the local areas, then we provide them with the doctors that contract with Adult Protective and will do the work, will do the assessment for us.
Okay, awesome. Thank you so much for your question. All right, everybody. If you have any last minute questions, go ahead, throw them in the chat and we can get that going. Otherwise, I don't want to keep everyone too long. Miss Norma, do you have any more comments that you want to make? Any information that you want to share?
No, I just wish I could have provided more information because, I was a worker and I did work a lot of cases. And when I was talking about all the different policies and all that, the types of abuse, I usually like to give a case scenario so that people can have a better understanding of the types of cases that we deal with, because that helps them get a better picture of what the abuse consists of.
Yeah, a better understanding of how it actually is in real life.
Yes.
Yeah, that would be super interesting. And if you have some of those short stories that you would like to share, or if you want to send them over, or maybe we can collaborate again in the future.
Yes, sure. I do like to talk about one particular case that I had on a young lady who had cerebral palsy, and she was a victim of sexual abuse. And a lot of times we don't listen to what they're telling you, but those are the people that are usually telling you the truth of what's going on. But you have a parent that right away says, oh, don't listen to her, she's retarded, or they use those terms. And then when you find out that in fact it was happening and the young lady wound up having a baby, she got pregnant, and these were her stepbrothers and her stepfather sexually abusing of her. And those are the type of clients that you really have to protect and listen, because like I say, a lot of times they're like babies that don't lie. They're innocent of a lot of this stuff. So you have to really focus on those types of things. And I always tell people, listen to what they're telling you, because a lot of times they might not be able to tell you the times that it's happening, but they can tell you how it's occurring, who's first, who's next, or what, but can't give you the actual time. But it's that's when that should be a red flag automatically. We also have those elderly people who get calls from scammers, or they have providers that tell them they love them, or they this and that, and get them to sign loans for them, take their money, and all because they're all alone and they need somebody to tell them they care for them. But it's usually the wrong way. And that's how they get exploited. So we have a little bit of everything, it's sad, but it is happening.
Yeah, absolutely. And hearing stories like that, it makes me very thankful for services like adult protective services, because a lot of people don't have advocates or people there to protect them, even if it's their own friends and family.
Right.
So that is wonderful. And, and these people that you think you can trust, like these scammers, they create these false relationships. So it's really awesome to have services like this. So thank you.
Yes. Thank you for allowing me to share.
Yeah, of course. All right. So I think with that, we're going to go ahead and wrap up. If
Okay.
anybody does have any more questions, they can email them to me. And we can get them over to Norma, and I'm happy to facilitate that. We have one last question in the chat, and it says, does SMP report to APS? And so of course that is also a case-by-case basis. If we are
Yes.
informed of things like that, of neglect or abuse cases, we are going to send it to the correct resource.
Right.
So that's
And
not
so
us.
do we. Sometimes if it's something that we need to report to SMB, we do it. Or I speak to the person that can help out. Like I usually call on Mr. Obregon and Ortegon, and he's the one that tells me, yes, it is something we look into, or these are the persons that you need to call and make the report with. So vice versa, we all help one another because we're working with the same clients and we need to protect them.
Yes, absolutely. And so, and we're never going to turn someone away and hear about something terrible happening and just being, well, that's not our department. But we thankfully are connected to a bunch of amazing different resources and different agencies. And so we are able to direct people in the correct direction. So thank you for your question, Rose. All right, awesome. So I'm going to go ahead and shut down the session, but thank you again to Miss Norma Rodriguez for joining us today. This was really awesome. I really appreciate you sticking around and doing the presentation and answering all these questions and sharing your anecdotes.
Thank you.
Yeah, and thank you all to all of our participants, and I hope to see you again tomorrow at 10 a.m. For the Veterans Association and Office of Inspector General talk. So thank you all. Y'all have a great day.
Thank you. Bye-bye.
Bye-bye.